Good evening. My name is Tanya Dale.
And I'm Wanda Williams. We are graduate students at William Carey University. This is NUR 666, Instructional Strategies and Evaluation of Student Learning. The title of our presentation is Personal Protective Equipment. The goal of this objective, the learner will understand the purpose of personal protective equipment. We have 4 objectives. They are: the learner will be able to identify the appropriate PPE based on the necessary precaution, identify the specific types of infection control precaution, list all components of our PPE ensemble, properly done and doff PPE.
We want to identify some pre-test questions just to get the learner more engaged into our teaching presentation. Do you use standard precautions on all patients? Should you wear a face mask or respirator N95 if you suspect the patient has the flu virus? What is PPE? Do you perform hand hygiene before or after removal of PPE? If you are the primary caregiver for a patient with C. difficile, is it okay to use alcohol-based hand sanitizer gel when leaving the room? Why do we wear PPE? When applying personal protective equipment, you must be aware of the hazards and be trained to use the appropriate personal protective equipment. Please be mindful that the equipment does not eliminate the risk. If the personal protective equipment fails, exposure can occur. To decrease the chance of failure, equipment should be correctly fitted and managed in a clean and serviceable condition. Choosing the correct personal protective equipment for the job is vital. It is important that employers and employees understand the equipment's purpose and limitations. If employees understand the usage, maybe they will not change or take off the equipment because it feels awkward. Adjusting the personal protective equipment may make it feel more comfortable, but is it wise? Infection control precautions are a set of standard recommendations designed to reduce the risk of transmission of infectious agents from body fluids or environmental surfaces that contain infectious agents. These precautions include the use of personal protective equipment that serves as barriers to protect against contact with infectious materials. Standard precautions are the basic level of infection control that should be used in the care of all patients all of the time. Use standard precautions in the care of all patients to reduce the risk of transmission of microorganisms from both recognized and non-recognized sources of infection. This applies to blood, all body fluids, secretions, and excretions except for sweat, whether or not they contain visible blood, non-intact skin, and mucous membranes. This is patient Wanda Williams.
Here come one of these nurses again.
Hi, my name is Nikki. I'll be your nurse for this evening.
Did you wash your hands?
Well, I was really just coming to introduce myself, but I will wash my hands if that will make you feel more comfortable.
Well, they told me that anybody that comes in my room is supposed to wash their hands.
Okay, I appreciate what you're sharing with me, and I will abide by what you're asking.
Do you wash your hands with all your patients?
I do. I wash my hands before I make any contact with them, but I'm just coming in to introduce myself before I provide you any care.
Do you wash your hands when you leave?
I do. Very good questions.
Okay.
Will that make you feel more comfortable?
It would.
All right.
I don't want no type of infection disease from this place. No, hospitals are nasty.
Yes, they really are. You are exactly right.
What type of precautions y'all have here?
We have standard precautions where we treat each patient as if there's something that may be identified with the patient. So therefore, we wash our hands and we wear gloves at all times when we're providing care.
Okay.
Okay? All right.
Do you know how blood and body fluid is passed from one person to another? Well, I will tell you. It can be passed through open areas on your skin by splashing different type of material, urine, feces, in your eyes, through the mouth, unprotected sexual activity. It could be oral, anal, or vaginal. Injury with contaminated needles, sharps, or anything that can puncture the skin, and also through prenatal development between mother and child, or during delivery at birth.
When should you wash your hands? Well, this should be done before, during, and after preparing food, before eating food, before and after caring for someone who is sick, before and after treating a cut or wound, after using the toilet, after changing diapers or cleaning up a child who has used the toilet, after blowing your nose, coughing, or sneezing, after touching an animal, animal feed, or animal waste, after touching garbage. If hands will be moving from a contaminated body site to a clean body site during patient care, you should wash your hands. How do you wash your hands? We have a recommended practice for hand washing. This includes wet your hands with clean running water, warm or cold, and apply soap. Lather your hands by rubbing them together with the soap. Be sure to lather the back of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. Rinse your hands well under clean running water. Dry your hands using a clean towel or air dry them.
Okay, I will demonstrate on how to wash your hand. I'm actually cutting on the cold water. Get my hands all wet up. Now we'll apply some soap. And get a good lather. You can sing, which I can't, so I won't. But I can count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Did you notice how I got up under the nail bed of your hand? I'm rubbing real good. In the back of my hand, in between my fingers, the base of my hand. Get good friction. Real clean. Okay, now we'll rinse. And never shake your hands. I will get a clean paper towel. Cut the water off. I will throw that in a trash can. I will get another clean paper towel. One hand in the downward motion. Throw it in the garbage. I know you may think this is wasting, but they're clean. Think about, you don't want to take anything home with you. And you do this process until they're dry. If you're using the alcohol-based gel, make sure that when you use that gel, that your hands are completely dry. They're dry. I'm clean.
Gloves. Gloves help protect you when directly handling potentially infectious materials or contaminated surfaces. Wear gloves when directly handling potentially infectious materials or in contact with contaminated surfaces. We have various types of gloves. We have vinyl, we have latex, or nitrile gloves may be worn. Change your gloves when visibly soiled, torn, or punctured. Wash your hands upon removing gloves, and gloves do not replace the need for excellent hand washing that Wanda previously just demonstrated. Gloves should be worn as part of standard precautions or contact precautions.
Okay, I will demonstrate how to put on gloves. Gloves come in different sizes. It is very important that you have the correct size that you're supposed to wear, because you don't want to get a glove that's too little and you puncture the glove putting it on, or you don't want to get a glove that is too big and it falls off while you're doing something. So I'm a size medium, and I have a medium gloves right here. And when you're putting gloves on, you don't want to fan and wave because you take a chance of contaminating. So I have my glove, slide it on. Fits perfect. It's not too tight, it's not too big, it's perfect. This is my second glove. See how easy it slides on? Not too tight, not too big where it's falling off. I can move around freely. I can stretch my fingers. Perfect.
Now Wanda's going to demonstrate glove removal. First, you should pinch the palm of the glove on one hand and pull glove down in all fingers. Form glove into a ball and place in palm of gloved hand. Insert 2 fingers of ungloved hand under inside of rim of gloved hand. Push glove inside out, down over fingers and around balled up glove. Grasp inside out gloves and discard into plastic bag or seal bag. Then wash your hands. Okay.
Okay. Discarded my gloves. I'm actually using the Purell alcohol gel to wash my hands. Use just enough. You rub as if you was washing your hand with soap and water. And it dries quickly. And if you put too much, sometimes it takes a while to dry. So put just enough what you need, and it should dry very quickly. They're almost dry. I put just a little bit too much, but it's getting there. Okay, now we're completely dry. Now we will discuss gowns. Gowns help protect you from contamination of clothing with potential infection material. Wear a gown when contamination of clothing with potential infection material is possible. Your gown should fully cover your torso, fit close to the body, and cover the arms to the wrist. Choose a gown appropriate for the situation. Disposable versus reusable, because reusable require laundering. You really don't want to use those. You want to use something that you can throw in the trash container. Fluid resistant versus non-fluid resistant. Sterile versus clean, depending on the procedure. Gowns should be worn as part of standard precaution or contact precaution.
Okay, you have to take it off. Now I will demonstrate how to apply the gown. I currently have selected a clean gown that has the fluid resistance, and this is what we use just for our standard precautions. We would not use this for a sterile procedure. This is a regular large, and they come in various sizes, so make sure you choose the gown that's appropriate for your size. And if I'm applying the gown by myself, I go ahead and tie my back first. Then I put it over my head. And I put my arms. And it ties in the back, so I wrap it around. And some gowns in our facility have ties on the side and some have the ties in the back. Clothing is completely protected from neck down below the waist, which is typically the area that you'll be working in when you're dealing with patients. And that's a demonstration of applying the gown. Contact precautions. In addition to standard precautions, use contact precautions in the care of patients known or suspected to have a serious illness easily transmitted by direct patient care or by indirect contact with items in the patient's environment. Illnesses requiring contact precautions may include, but are not limited to, the presence of stool incontinence, which may include patients with norovirus or rotavirus, draining wounds, uncontrolled secretions, pressure ulcers, presence of generalized rash, or presence of ostomy tubes and or bags draining body fluids. A contact precaution sign that you may see outside of your patient's room that just gives you the information that you need in order to warn you of what is expected for your minimum PPE before entering the patient's room.
Okay, I will talk about special contact isolation or precaution. In addition to standard precaution, use the special precaution in the care of a patient known or suspect to have C. diff, which is Clostridium difficile. I got tongue tied on that one. And remember with C. diff, you can't use the alcohol gel. You have to use soap and water to wash your hands. That's the only way it will require to remove the C. diff spore. This is one of the isolation signs you may see prior to going into a patient room that is on contact precaution. And with contact precaution, it can be transmitted by direct patient contact or by indirect patient contact. So if you touch something like feces or something that is on the environment, bedside table, bed rails, or anything, you still take a chance of contacting C. diff just by touching the environment.
Mask. Surgical masks help protect your nose and mouth from splattered body fluids. Respirators filter the air before you inhale it. Surgical masks and or procedure masks can be used when you are dealing with patients that could possibly be on respiratory isolation, or if you're dealing with a procedure where you are trying to protect the patient for when you're doing sterile techniques. Surgical masks help protect your nose and mouth from splattered body fluids such as blood, respiratory secretions, vomit, urine, or feces. Surgical masks should be worn as part of standard precautions or droplet precautions.
We have different types of masks. We have surgical masks, procedure masks, and also N95 or respirator masks. This right here is a face shield mask. If you're dealing with, just say for instance, if you're putting a PICC line in or anything that's going to cause blood splatter, always have on a face shield mask to protect the face and your mouth, nose, everything. And you would take it from the side, put it on, behind your ears, cover it, well, behind your ears, pinch it. They're not comfortable, but it's going to protect you. And this is a face shield mask. So if anything splatter, it won't get in my eyes and I'm protected. Just take it off. This is an N95 mask. We use these on patient that has TB. They come in different size. This is an N95 small. This is a regular. You can tell the different size. I wear a small. And how you would put this on. And pinch the nose. It should fit, nothing, it's not over my chin or under my chin, perfect fit. And take it off. And I'm also demonstrate the one that's too big so you can get an idea of what I mean by the different size and make sure it's the correct fit. But this one right here is a little bit too big. I can actually get room right up under here. When I move, I can feel, when I breathe, I can feel the air coming around, so it's actually too big. We also have a different type of N95 mask. And also with the N95 mask, you have to get fitted annually. So if you haven't been fitted for one, you can't wear it. I don't really too much care for these because too much hard work. But if the facility required, I'm gonna wear it. But you would put it on. And my earrings are actually too big, y'all. You're not supposed to wear those in the hospital anyway. FYI. This is a teaching project. Okay, this is another N95 mask. Everything is secured. Nothing is coming out. And one more, this is a surgical mask. Typically wear these during droplet precaution, somebody that has flu, or if you have a TB patient and he's gonna go out, he should have on a surgical mask and not an N95 mask, because remember the N95 mask, you have to be fitted for those annually. So this is just a regular surgical mask. Put it on. Be patient with me. And you tie it up. Make sure it's secure. You hate to be doing a procedure or something and it comes down. So make sure it's secure. Pinch your nose. And you're protected. And take them off. Actually, it just snaps off.
Now let's talk about droplet precautions. Droplets can be generated from the source person during coughing, sneezing, talking, and during the performance of certain procedures such as suctioning or bronchoscopy. Droplets may contain microorganisms and generally travel no more than 3 feet from the patient. That is the key for droplet precautions, 3 feet. These droplets can be deposited on the host nasal mucosa, conjunctiva, or mouth. Diseases requiring droplet precautions include but are not limited to pertussis, influenza, diphtheria, and invasive Neisseria meningitis. Wanda demonstrated the N95 respirators, and of course she showed you the various kinds, and I just want to give you more information about the N95 respirators. These respirators decrease the risk of breathing in very small particles in the air caused by sweeping, sawing, and mold removal. The respirator must have a tight seal against your face, as Wanda showed, so that most of the air you inhale goes through the respirator to correctly protect you. Wear a respirator when you are doing anything that creates a lot of dust, sweeping, using power saws, shoveling debris, or cleaning up mold. You usually do not need to wear a respirator inside a home or building unless you are doing these types of activities. Respirators filter the air you breathe to help protect you from microorganisms including bacteria and many viruses. The types of respirators include disposable respirators that we use in hospital facilities, which are the N95 that I previously showed you.